Welcome back, everybody, to the show. It's Beyond the Hot Flash podcast, and today we're talking about a topic that so many women ask and often don't get clear answers. I know for myself it's the same thing. How do we stay strong, energized, and sexually healthy through menopause? So joining me today is Dr. Daniela Steyn, a lifestyle medicine physician and a menopause expert. Dr. Steyn, welcome.
Andrea, thank you so much for having me.
Oh, it's so great. I'm so glad we're having this conversation today. I think to get started and get into the meat of this podcast, I'm going to ask you a question. It's a burning question that so many people have. Why are women so scared of taking HRT, hormone replacement therapy? What are they afraid of?
Andrea, you are going to fix that problem with your podcast. So thank you so much for having this podcast. I honestly believe it's a lack of education, a lack of knowledge, and it is a generational lack of knowledge. Unfortunately, for all the women 10, 20, 30 years before us, after the Women Health Initiative study came out, were so misinformed, maybe gaslighted by their doctors, or just not enough research that has really been done in women's health up to now. Luckily for us, the pendulum is swinging to the other side now, and women are being more educated. There's a lot of books to read, podcasts to listen to, and we now have the ability to educate ourselves, to Google, to see what's the research. We have online access to randomized controlled trials. I believe that women who are very knowledgeable and read up do come to a spot quite easily where they are comfortable using hormones. Specifically in my clinic, everyone wants hormones. That's why they come to me. So I see that maybe 1 or 2% of women who are very comfortable using hormones. I believe a lot of women don't use hormones just because they don't know. They haven't really invested that time to research it for themselves and really understand what significant difference it can make to their quality of life and their longevity to be on hormones. You know, as women, we
Absolutely.
often just think we have to suffer through it. You used to suffer through so many things, whether it's childbirth or packing your children's school lunches or being up at night with babies that's crying, and then with work stressors, then come menopause and you're up at night with hot flushes. And we often think it's just part of life. And then sometimes our girlfriends tell us, oh, they had it even worse. Then you think, well, my symptoms are bad, but it's not as bad as Sarah's, or it's not as bad as Hannah's. Maybe I should just suck it up because they were able to suck it up. That is quite often. And then also a lot of myths surrounding fear mongering surrounding hormone replacement therapy.
Yeah, yeah, that's definitely a big one. I think I know my mom, she had severe familial heart disease, and so back then, and the dad was, oh my gosh, you'll get cancer. It's bad if you've got heart disease, and so I just wanted to bring that in very quickly, and I think it's important that the people that are watching really take time to glean and get information and really understand where we're at the moment. That is very old school. We're moving along. We've got lots of questions to ask you, and I'm just so grateful for your time today. Let's dive into muscle health. Many women notice that their workouts don't feel as effective in midlife. What is going on with menopause, and why is this happening?
That's a very, very big part of menopause is that people experience in their body, due to the hormonal change, a body composition change. So quite often when people will tell me that they're even the same weight, but they look different. Their legs are thinning out, their bum is thinning out, and they're getting this weight around the abdomen. We have a body composition analysis machine in the clinic, so I can clearly track women in studies that I do to see that women who have more muscle in their body, typically as they go through menopause, their metabolism would be faster, less likely to gain weight, whereas women who have less muscle mass would, when they go through menopause, have a bigger shift in their body composition and a slower metabolism because your metabolic rate for muscle is so much faster than for fat. These are the people who typically gain weight more easily through menopause, who would say they're doing exactly the same. So what's to blame for this is really hormones. We have in our body a lot of hormones. But when we talk about menopause, we're specifically talking more about estrogen, progesterone, and also testosterone. So testosterone, women do naturally have testosterone in their bodies. It's not only men that have testosterone. We interestingly have more testosterone than estrogen in our bodies, but it even gets measured in different units. It's a different sized molecule. We have much less testosterone than men, and our testosterone is not as closely linked to menopause as to aging. Another hormone that we have in our body that helps with muscle mass is DHEA. That hormone in our body gets converted either into estrogen or testosterone. It's a precursor. Both these, testosterone and DHEA, slowly decline with age. So with menopause, you have a big drop in estrogen, a big drop in progesterone. Your testosterone will slowly decline. However, once your estrogen drop and your progesterone drop, that does cause quite turmoil in your hormonal balance, which can, at that point, you will notice more severely your symptoms of lower testosterone.
Yeah. It's quite incredible. I love you talking about testosterone. I think for a lot of people, if you've gone through perimenopause and you are using HRT, there's not a lot of talk out there about testosterone unless you go and look for it. And so I know that for women, what are the big things? What are the symptoms? As far as I know, it's the big thing, which is your sex drive, which is your libido, and then fatigue, which you're talking about so often. This is a big problem, but there are many other things. And I will tell you, I'm using testosterone today. Doctor, is day 6 of using testosterone, and there's been a major improvement across the board. But I will say, do you know what is so interesting? And these are things that are just coming up, right? My skin. I had like severe dry hair, dry skin, my feet, my heels, like chronic, crepey skin. I don't know if it is the testosterone, maybe it is, but I don't know. That's what I'm noticing. In 5 days, I'm not doing anything different except that the fatigue is gone. I still sleep amazingly, but I'm not lolling around at 7 p.m. like I've got nothing left in me. Doing my yoga and now adding my weight training, I'm seeing the gains. It's so exciting.
I enjoy giving testosterone to women. When women come to my clinic, I have a lifestyle medicine clinic, so I really stress the importance about lifestyle medicine. I won't just give testosterone to you if you're up all night scrolling on your phone, drinking a lot of alcohol, not having enough protein in your diet, not exercising. None of these medications in menopause I would call a miracle drug. All of them should really be used in conjunction with all your other lifestyle medicine strategies that you implement. So that is really first and foremost. If you want to have
Yes.
good muscle health, you don't start more muscle health. And this is not to bulk at all. This is to maintain. So we have our peak muscle mass as women in our 30s, and then it slowly declines. Even before menopause, it starts declining. So if you read up on longevity, you'll see that your biggest predictor of longevity would be your muscle mass. I work in a big hospital and we admit people every day with hip fractures. If you are 90 years old and you have a hip fracture with very strong muscles, in hospital, we will fix your hip for you. The next day you'll go home. You'll get up out of bed and you'll go home and you'll continue to live a strong, independent life. If you do not have strong muscles, if you cannot get up from the floor without using your hands, if you cannot get up from a chair independently, then if someone does break their hip at an older age, your risk of dying is actually 30% in that first year. Just because of that lower muscle mass, after your operation, you're not able to get out of bed. Then you have to stay in hospital for 3 months to do rehab. You really increase your risk of dying. And
Yeah.
it's not only for hip fractures, it's
Yes.
across the board. People with more muscle mass are
Yeah.
stronger, live longer.
Yeah.
But testosterone is not our number one treatment we give for people for increasing their strength. The number one would be to exercise and to have adequate protein in your diet and to do strength training. And that looks different to different people. It can be heavy weights in a gym, but it can also be doing squats against your own body weight in front of the mirror, or just sitting on a chair and standing up and sitting and standing repetitively until you tire out. So this does look different for different people. And it's so important to get someone in your team, get a personal trainer, get a nutritionist, get a doctor that's educated and on board with what you need. But then, if you're doing everything correctly, when people come to me for hormones, for muscle mass, I always first start with the estrogen progesterone part. Because I really feel that's where you have the biggest bang for your buck. And it's only after you've been on adequate doses of estrogen and progesterone, only typically then, after 6 months, then I would consider adding testosterone.
Yeah.
So testosterone is I always follow our Canadian guidelines for hormone replacement and for menopause. I give testosterone to men all the time because it's very easy to monitor when you do blood work. As men get older, the testosterone does get lower. For women, it is slightly trickier because it's not FDA approved to be
Yeah.
prescribing testosterone in Canada. In Australia, it is, and they have a great formulation of testosterone that they give women. But in Canada, there's more nuances to it just because we don't have a specific Health Canada approval for the use of testosterone in women.
And so I think for me, it's quite interesting that we get it off label through a compound pharmacy. I love it. So if the listeners wanted to hear, it looks like a little deodorant where you use 1 or 2 clicks. It comes out, it's a pea-size amount, and you put it behind your knee, inner thigh, wherever it is, and yeah, it's really easy to use with all of your other hormones that you use. I think for me, what is the normal reference range? Like, what is is there a such thing as a normal testosterone level for women?
So, interestingly, our guidelines to replace hormones are not really to measure the hormones, but to treat according to symptoms.
Okay.
So, if you go to your doctor and you say that you have hot flushes at night, you want estrogen, we don't have to do your blood work because you might have significant hot flushes at night and your estrogen levels might be normal, and then we can still give you estrogen. As you get older, your estrogen receptors get less and less and less. So then maybe at the age of 70, if I do your blood work, your estrogen would be very low, but you won't be getting any hot flushes. And then I don't have to give you estrogen just because your blood level is low. So that is our way of thinking usually with estrogen progesterone. With testosterone, however, we do blood levels because we always want to make sure it stays within physiological levels for women. Because I don't want to make a man out of you. That is what we can do at much higher doses, right? And we don't want to do that. We want to give you just a little bit of testosterone. I would usually start at 2.5 gram. I always give it through the skin.
Milligrams.
Milligram. Yes, that will make a man out of you. And we always, as you said, we give it compounded. So for a man would be 5 gram that we give for a man in a sachet daily. That's very easy. And I know some of the other clinics who give it to women would actually give that sachet, male sachet, to women. But for a woman to divide that little sachet in 10 to dose, from my perspective, that's not a very safe way to go about it. So
And it's also, I think it's just a mess. It's a nightmare that I must sit and try and divide it at 10 p.m. at night. No thanks. Yeah, I agree.
And we have great, very reliable compounding pharmacies who've been doing this for at least 30 years.
Wow.
So we use someone with a very good reputation who can compound it to you so that you know when you get that 2.5 milligram or 5 milligram, depending on where you are, what your needs are, what your symptoms are. Still getting back to Canadian guidelines are not to give it to increase your muscle mass, even though we know research shows that it does help to
Yes.
your muscles to recover. Our guidelines is specifically to give to women who experiences low libido. That is a very, very big topic on its own. And it is something very satisfying for me to treat as a physician because that can make such a big difference on your quality of life.
Absolutely.
What typically happens is when we have all our hormones the way we have it at 18, every month you will ovulate. At the time when you ovulate, your hormones really peak. Then your libido will peak with that in order to help you think more about sex and have more desire for it and have more satisfaction for sexual intercourse. You can have sexual intercourse month long, but typically women would have a peak during the time that they ovulate. After menopause, you don't have that hormonal peak because you're not ovulating anymore. And then you don't even feel like other days in the month. Libido is a very big topic. That is the only reason, really, that's Health Canada approved for women to be using testosterone. In my practice, I never prescribed testosterone on its own for libido. Actually, the first person that I got in my wellness clinic was a marriage counselor. Because women would come to me for testosterone for libido, but as I was talking to them, I realized that there's something lacking in their relationship. And if you don't have a healthy, positive, safe relationship with your partner, then it doesn't make sense to medicate you, right? And then also another very big thing that breaks libido down would be, or inhibits libido, would be stress, unfortunately. So I ask most patients, if you go away with your husband to Bora Bora for a week and you're in a beautiful white fancy bed, do you feel like being intimate? And most people would say yes. And if that is the answer, what you need is to manage your stress and to go on a holiday. Then giving your hormones is also not really the answer. People who testosterone makes a big difference for would be people who do have a loving relationship with their partner. They do go to Bora Bora, they are relaxed, and then while they're there and they love their partner, they just feel blah. And then when they do have intercourse, they would say, but they're not getting an orgasm, or they don't get stimulated.
And have you heard people say, I love the word, the intensity's just not there. It's like a half pop. What is that exactly? So if you guys are listening, it's like you'd rather read a book or just make dinner. Really not interested. So, okay, so we're going to treat, so now you've got all of the things in place, but it's just not happening. It's blah. So
Yes,
now,
and
is this when we do testosterone?
most people, testosterone is very helpful. We
Okay.
always first have to do that physical examination, make sure that you are not, that there's nothing wrong in the vagina. That is quite important because what often happen is if you've been low on estrogen, the skin can get very thin. It can get very painful. So we must first treat with estrogen, make sure that the skin is not too thin and it's not painful, all right? And then your body won't secrete as much lubrication, so you will need an extra lubricant. But then when you've addressed these things, you've also addressed what you want. There's quite a lot that people learn about their bodies, but the importance for a woman to get an orgasm before a man gets an orgasm, for most women will take maybe 15 to 20 minutes before you have orgasm. There's a lot of education we can provide. They call it not just foreplay, but outer play to do other things to stimulate your body and to stimulate your whole body.
Mm-hmm.
And only then, after a woman has had an orgasm or multiple orgasm, then it's the guy's turn to get an orgasm, because for them it's typically a much faster
Yeah.
experience.
Yeah.
So once you understand all those things, then testosterone is very helpful to just be the way you were 5 years before menopause, to have a more libido, more interest into sex. If with testosterone it's still not good enough, there is something else we offer. We call it Scream Cream. It is similar to Viagra in men, where it's also compounded, a cream that you can, just prior to sexual intercourse, apply to the clitoris that improve blood flow to the clitoris and to the vagina, and increases sensitivity and sensation in the genital area.
Amazing. I think this podcast is going to be the hottest one out there. I'm so glad. This is such important information. And you know, doctor, I think so many times people, maybe it was our folks or before then, it was just a subject that you didn't talk about. And these are the burning questions that we have as women. You need to understand your body, know what's going on, understand the difference. Am I stressed? Am I not? So yeah, love all of this. Thank you, thank you, thank you.
And it can make such a big difference to your quality of life if you address that. That's just fun. This clinic's so rewarding because with a lot of other things that we deal with, especially in the hospital and healthcare and life, there's no easy fix for it. If you have a child that's making wrong decisions, there's no easy fix for that. If you have another medical condition, there's no easy fix for that. But if you don't have a satisfying sex life, that is something that you can significantly turn around. If you don't have enough
Yeah.
energy after menopause, you can significantly turn that around. If you are gaining weight after menopause and you
Yeah.
treat your hormones, you can significantly turn that around. So
Yeah,
that's very
exactly.
rewarding, and people find it very rewarding.
Amazing. I've got one more question, then we're going to wrap it up because I know you're busy. Can we talk a little bit about creatine? I'm
Ooh, that's
loving
big.
using creatine. You
Yes.
suggested it. I use it every single day. Let's talk about that.
So similar to testosterone, this is a hot topic that a lot of people use for heart disease, dementia prevention, these. It's used for a lot of things that there's research showing it's helpful, but it's not part of our guidelines yet. So I'm really just going to talk about the strictly medicine guidelines. But if you look at it, you'll find a lot of studies that came out this year to show that there is proof that if you start using it in this optimal window where we are in our perimenopausal years, same as testosterone, same as estrogen and progesterone, it doesn't cure dementia. So when I see someone in the hospital with dementia, I don't give them estrogen and creatine. But if you start using it, we call it a healthy cell hypothesis. In your perimenopausal years, where your cells are still healthy, it can keep your cells healthy for longer. So 50% of your creatine your body makes on its own, 50% you get from your diet. It is one of the things that supplement can be very helpful for if you do not get adequate from your diet. It is something that you can easily supplement. There are a lot of very clean protein or creatine powders that's available that you can easily mix into your coffee or into your protein shake. It is most helpful if you do it with muscle strengthening exercises. Same as what we said earlier. It doesn't help if you just take creatine and you lie on the couch all day. That's not going to help you at all.
No.
So we use creatine to help us to keep our muscles stronger, to build muscle. We don't use it as women to become male bodybuilders. And unlikely that creatine on its own is going to bulk you up. You use it to maintain muscle mass, and it helps you when you specifically intentionally do exercises to protect your muscle density or to increase your muscle density. Creatine is helpful for that. It is, some women do a loading dose where they start with higher doses. Some people find that that can cause water retention. So some don't like that as much. Then they just use a lower dose. Also 2.5 to 5. Was this now milligram or gram a day? I think this one is
Oh,
gram a
I think
day.
it's gram. I use 5 a day and I am
Yes, it's
great on
gram.
that. And then I'll
Yes,
add the
for
little
most
extra because
people.
it's not doctor. This is Andrea speaking. I use 10 because I'm researching all the time about how it helps with cognitive function. And I've noticed a huge difference with like the foggy brain thing, but just cognitively so alert. So I've just heard that that extra 5 makes it go past the blood brain barrier, which is they're seeing massive results. So I'm on it all day watching all these things happen. Very exciting times we're living in, right?
Yes, for sure, for
It's
sure. Have you
incredible.
noticed any water retention for
I actually
yourself?
haven't. No. So it's probably between 5 and 8 grams. My first scoop is a proper 5, and the next one is like a bit more than half of a little scoop. So it's about 8 grams I'm taking a day. And I just feel amazing on it because I started doing the weight training. It is different. It's tough, man, and the recovery is just so great. So I have heard, I don't know if this is true, do we need to be drinking more water than usual or just making sure we are drinking lots of water?
That is important regardless. The
Yeah,
dose of creatine that you're using is not high enough to give renal failure at all.
right. Okay.
But if you were at risk of that much higher doses, then you would have wanted to drink way more water.
Yeah.
However, just drinking enough water does help with your muscle recovery. It does help with cognitive function because when you do become a little bit dehydrated, you will experience brain fog easier.
Yeah.
So
Doesn't that make
definitely.
sense? It's like, I think sometimes you must be, when you see patients come, it's like the basic things in life is eat food, drink water to stay alive. And if our body is what, like 70% water, if you don't have much, your brain's not going to work. It's just such a basic thing. And it's a good reminder for all of us.
Yes, and it can make a
Awesome.
significant difference in your quality of life, all these things.
Yes.
And then clean living. I think that's part of the reason why you're doing so fantastic. You're really a model patient, but you
Oh,
have this clean living. You always have that positive outlook on life. You do your yoga. You really practice everything that you preach, and that makes a big difference. It's not just the hormones.
no,
It is
yeah.
doing all these things in combination, prioritizing your sleep, prioritizing movement, prioritizing proper whole food nutrition, social connections, and having purpose and passion.
Oh, so many tips. Guys, I want to show you this. If you haven't got this, look, this is Daniela's book that she wrote. It's called Thrive Through Menopause. It's on Amazon. It's anywhere you buy a book, you'll find it, even Indigo. I've read this book back to front and I've got marks all over it because it's full of tons of fab case studies. You'll read something, you'll be, oh, that's me, oh, that's not me, but that's interesting. And then next month, you'll have that symptom and you'll be like, I need to open the book again. Oh, it's just wonderful. Get the book. I'll put all the information on the show notes for the podcast on Spotify, and then on YouTube, it'll all be there as well. What an encouraging session. We can thrive through menopause. We want to be strong. We want to thrive. I'm excited. Thank you for giving us so many practical, wonderful tools today.
You are very welcome, and thank you to everyone who's listening, investing in your own health and investing in the health of your sisters.
Amazing. Thank you so much. There were some really cool topics today. And please, let's do it again. I think there are many other things that we need to talk about.
Good. Take care.